ॐ शुक्लाम्बरधरं विष्णुं शशिवर्णं चतुर्भुजं प्रसन्नवदनं ध्याये सर्वविघ्नोपशान्तये। ॐ गुरुभ्यो नमः। ॐ वक्रतुण्डमहाकाय सूर्यकोटिसमप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा। श्रीमहागणपतये नमः। प्रार्थनां समर्पयामि।
Namaskara, with the prayer to Lord Ganesha and Sri Krishna, and with the blessing of Pujya Sri Suganendra Tirtha Swamiji, I would like to welcome everyone and thank you all for tuning in on a Sunday afternoon. Happy New Year and Happy Shankranti to all of you. Sri Venkatakrishna Temple in Thousand Oaks is hosting this event. The temple is managed by Sugnana, an organization affiliated to Puttigamata Udupi. The temple holds daily prayers, provides prasada in the form of lunch and dinner every day, not just the weekends. This is a must-do for anyone who's visiting LA. It's not just in this temple here, in all their temples all over the world, they usually have lunch and dinner, and the prasadam is really God's gift. They also hold many classes for kids. They teach lokas, promote Indian culture for kids, and support various artists, even bringing Yakshagana from India. And then they do blood donation drives and various other events. We all are so excited to be here to bring this important and life-changing information to Kickstart 2021 and take the reins of your health in your own hands in this post-COVID era. This is the introductory session, and over the next 8 weeks, we'll go over all of these in more detail. I'm Dr. Anita Kankar. I'm a primary care physician and also board certified in lifestyle medicine. I just also want to share this. I studied in Kasturba Medical College, Mangalore. And then when my parents came in for graduation, and after graduation, we went and visited Udupi temple and got the blessings. And then it's such a coincidence that I just got board certified in lifestyle medicine. And this is the first presentation we are doing after I got board certified. So I feel truly blessed for this opportunity. Thank you, Gnanamurthy ji, for giving me this opportunity. And for most of you who have heard me and Dr. Sirisha and also who are already in my various groups, this program we made specifically for you, covering various other topics which we normally have not discussed. I just want to do this disclosure that we are doing this voluntarily just to educate our community, and then you have to talk to your medical provider before making any significant dietary changes, because you can see changes happening within weeks, and your blood sugar or high blood pressure, anything will fluctuate. So you have to work with your physician if you change your diet, and you have to take B12 supplement. That is non-negotiable. If you're on a plant-based diet, and even other people, they have to take B12 supplement. You cannot do everything naturally. And so today we are having, Dr. Sirisha Patluri will talk about the nutrition, and we have Dr. Deepthi Karnam, who is a nephrologist, and she'll talk about the kidney disease. And Dr. Mithika Kanabar will talk about the technology and substance addiction, and also the relevance to Indian culture and how to make the change. Like, we are giving all the information, but how do you make the change? And I will just quickly go over physical activity and what the future programs we are offering. And why is this diet and lifestyle? It's even more important right now, because you must have already seen that how all the diet and lifestyle affects all these heart disease, diabetes, chronic kidney disease. All this is affected by diet and lifestyle. And this, in fact, how the outcomes are different for people with disease. The COVID outcomes are different, you already know. So we have to change our diet and lifestyle for this and many other reasons too. And this is a slide which shows how India is the #1 in the world for the highest number of deaths due to diabetes. It's in fact called the diabetes capital of the world. And it's It's unfortunate that India being a vegetarian country and where yoga, everything is from India, all over the world, people are using it. And we are having, I mean, the numbers don't lie, you know. So this is number one. And why is it? That's the question to be, we have to ask ourselves, what are we doing wrong that we have been, I mean, there's so much diabetes. It's not just diabetes, all the other heart disease, everything is, you know, quite high, even among vegetarians. So for diabetes, I'll quickly tell you why it's not the sugar or what causes diabetes, it's the insulin resistance which causes diabetes. That's because of the high fat intake we are having. The fat causes oily food, and you know, it's not just the meat products, it's just the oily food what we eat, and all, and a lot of milk products, especially now we eat like a lot of paneer, add lot of ghee and butter and sweets and stuff, so that increases the fat deposition in our muscle cells, will cause insulin to not work. So that's the reason we have insulin resistance and blood sugar, one of the main reason. So this is like, so that's what is happening now. The medicine, what we do is called the sick care. Like the doctors, we just take care of sick people. And that's why you see so much line, like people are sick and there's line for pills and surgery. That's why you see so many multi-speciality hospitals all over India. Like, you know, they have the best care, but why there's such a big line? With this presentation, we want all of you, the line should be longer in the lifestyle change, and then very few people, of course, will need to go to the doctor. So that's what we hope to do in today's presentation. Uh, so I'm giving it over to Dr. Sirisha. So you must already know that any food, any kind of food, if you're craving, I mean, she can curate them the best in any food. Like, you know, and it's not only taste the best, it'll also be very nutritious. So go ahead, Dr. Sirisha.
Thank you, and Dr. Anita. First of all, thank you, Gnanamurthy-ji, for starting with a very nice prayer. One thing we really miss in this pandemic is visiting the temple, so felt very nice to see the puja. And then thank you, Anita, for a great start, explaining why we need to do this, showing how India is like diabetes capital and how we can change it one seminar at a time. And we want to thank Temple for giving us this opportunity. I am a dietary and lifestyle medicine coach, now working on diabetes workshops as a facilitator. And as Anita mentioned, I like to curate whole food plant-based recipes, and this is our website, and I and Anita started this plant-based Los Angeles, and this is my Instagram. And then we always talk about diet. So we want to call this a whole food plant-based lifestyle. So many fad diets out there. It's confusing what to follow, what not to follow. So American College of Lifestyle Medicine has simplified this for us. They instead of asking us to stand in line for pills and surgery, they gave us a prescription on the plate. It's a whole food plant-based plate where half of the plate is filled with fruits and vegetables, and the other half is with plant proteins and then whole grains, and the drink of choice is water. Isn't it amazing? We all know how important the water is, but previously in the food plates, milk was given as a choice of drink of choice, but now it's water is the drink that's recommended. So why plant-based diet? In the previous slide, it shows like how American College of Lifestyle Medicine works on all the pillars. In addition to the wellness habits like sleep, exercise, managing stress, having healthy relationships, being mindful, My favorite, I am a big fan of whole food plant-based lifestyle. Why am I a big fan, and why I promote this in my workshops and on the social media platforms, is because I myself benefited from this type of lifestyle, as well as my loved ones and the participants in my workshops. We see such amazing changes within 3 weeks. Um, so let's define what is whole food plant-based lifestyle. It's focused on whole, unrefined, unprocessed foods. It's made up of fruits, vegetables. There is no branding. It's whole grains. It's beans, legumes, nuts, and seeds. So it's already the foods we're already eating in our Indian culture, but just making small changes, including more vegetables, whole grains, instead of oils, and then ghee, and then paneer and other cheeses, which you heard Dr. Anita saying how it is increasing the insulin resistance in our Indian community, right? So, and then coming back to the next slide, first of all, food is like, it should never be for weight loss. Food is associated with our culture. So we can follow our culture and then have all these amazing foods. So when it comes to whole food plant-based diet, we recommend at least 4 to 5 servings of vegetables and 3 to 4 servings of fruits. So people ask me like, oh, what is a serving of vegetable? It's half cup of cooked, vegetable, or 1 cup of raw vegetable, just like that. 5 or more servings of whole grains. So it's 1/2 cup of cooked brown rice or 1/2 cup of cooked quinoa is 1 serving of whole grains. Similarly, we ask like at least 1 to 3 cups of legumes per day. So 1/2 cup of cooked beans comes under a serving of legumes. And it's better to avoid oils because these are like pure fat with no nutrition available and high in calories. We'll talk more about the calorie density in the upcoming slides. In the next slide, I want to show how the fiber, in my workshops, this is a common question I get about the plant-based sources of protein, plant-based sources of, in the previous slides. In my workshops, the common question I get is like, oh, we want to go plant-based, but we worry that we won't get enough iron. And that's a very valid question, because not many people know that you can get enough iron from plant-based sources. All these greens like our spinach, amaranth, kale, mustard greens, which is used a lot in Indian cuisine, and then chickpeas. Who doesn't like chana masala, right? So they're all filled with iron, along with our pumpkin seeds and lentils. And when you come to our Indian foods, like, the basic tadka we make for every curry or dish, they have ingredients which are high in iron. See, coriander seeds, mustard seeds, and turmeric, jeera, cumin seeds, all these are loaded with iron, along with our drumstick leaves, methi leaves. So do not worry about iron content when you're going plant-based. We have abundant iron in our plant foods. When coming to the next slide, we want to talk about the protein. So as soon as someone talks about going plant-based or whole food plant-based, they say like, oh, I might get deficient in protein. So no, we don't have to worry about that, because we have abundant resources of plant-based proteins. Instead of separating like protein, calcium, and then iron, if we are eating whole foods, we can get all these sources abundantly. But if we want to go and look at, oh, what are the protein content of each food, if we look at dals, they have like 24 grams of protein per 100 grams of the dal. So we are very lucky that in our culture we eat a lot of dals, so we don't have to worry about protein. Even if you're not eating dals, there are seeds like like amaranth seeds, and then the barley, the wheat, bajra, and then dried, fenugreek leaves, and then a lot of chickpeas, and then rajma. All these are abundant sources of protein. And then when it comes to calcium, yeah, everyone must have saw the ad saying like drink milk for calcium. No, we don't need to drink milk, because we can get enough calcium from all these plant-based foods. For example, kala chana and then rajma. You can make these curries, which are very simple to make at our home, and then you don't have to worry about protein, iron, or calcium, because they come as a package. Instead of pinpointing like, okay, this is calcium, this is protein, this is iron, we have everything like a package. And the added advantage is these plant proteins, and these come with phytonutrients and fiber. In the next slide, I want to talk about how important the fiber is. We are America is fiber deficient. We are not protein deficient, but we are fiber deficient. So I would like to call fiber a superfood, because not only it helps to make us full with our food, but there are so many added advantages. When we are eating more fiber that is present in lentils and all the beans and vegetables, we are increasing our prebiotics. As you can see here, the prebiotics are increasing, and then the prebiotics will later be fermented by the bacteria in our gut, and then they in turn lead to production of short chain fatty acids. So short chain fatty acids are going to help us in improving our health in many ways. Like it's been shown how having good gut microbiome can in turn reflect to increased immunity, weight loss, as well as decreased risk of other chronic diseases. And when we look at the relation between dietary fiber and breast cancer, you can see how as the dietary fiber intake is increasing here, every 10 grams it's increasing, the breast cancer risk is coming down. So where is the fiber present? The fiber present is in the whole foods, and animal products have zero fiber. In the next slide, we will talk more about the difference between plant and animal-based diets. See, it clearly shows like plant foods are high in fiber and animal foods have zero fiber. So if someone tells you that we are protein deficient, eat animal foods, we don't have to, because plant foods come with a lot of protein as well as fiber, which is the superfood. And cholesterol is none in plant foods. Animal foods have high cholesterol, and most of the plant foods are low in fat. Animal foods are high. And again, the calorie density, plant foods are low in calories when compared to animal foods. And the most important thing, we get our antioxidants, the micronutrients, vitamins, minerals, everything from the plant foods. And animal foods have carcinogens. So this is a big difference. And going here, like I just want to mention, like vegan is not equal to whole food plant-based. Vegan is great for the environment, and it's a compassion for animals, which is amazing. When it comes to our diet, sometimes vegan can be unhealthy because potato chips, Oreos, and then soda are vegan, but they're not healthy. So don't be fooled if you're eating processed vegan food and thinking it's healthy. No, oil, even though it's vegan, can increase your risk of diabetes and other chronic diseases. So whole food plant-based is different from vegan. Next one, please. Yeah, so inflammation is like is responsible for many chronic diseases. Inflammation is responsible for many chronic diseases in our body. And here you can see, like, if inflammation is the fire, the fuel is animal product, processed oils, refined carbs, saturated fat, and smoking. All these act as a fuel to the fire. What is acting as a fire extinguisher? All our amazing whole foods, the fruits, vegetables, beans, lentils, whole grains, and herbs and spices. We are blessed with all the spices and herbs in our Indian culture. They all act as fire extinguisher to our inflammation. And as Dr. Esselstyn quotes it very well, the green leafy vegetables are powerful fire extinguisher on the inflammation in our body. Next one, please. Yeah, as I was telling you about the calorie density between animal foods and plant foods, as you can see here, how the calorie density of the vegetables is comparing with the calorie density of animal foods. Calorie density is nothing but it's a calories per pound of food. So when you look at per pound of non-starchy vegetables, for example, if we want to talk about our Indian non-starchy vegetables, our lauki, we call sorakaya, lauki, or bottle gourd. It's a non-starchy vegetable. Okra, eggplant, turai, all these cucumber, all these amazing vegetables we regularly use in our Indian cooking. They are very low in calories. What adds calories to our diet is, see at the bottom, you can see how the oils are 4,000 calories per pound. So when you're adding these oils to your vegetables, then the calorie density of the vegetables is increasing. Not because the vegetables are dense in calorie, because you're adding these oils into that. And when you come to the middle figure, here it shows, like, as the water content of the vegetable is decreasing, the calorie density is increasing. That's the reason we say, like, fruits and vegetables naturally have so much water in them that makes them less calorie dense. So starting a meal with a salad, a soup is a great idea, because they are high in water content and also filling your stomach. And when we look at the dairy products here, these ghee, butter, they have 100% fat. And paneer and cheese has 74% fat, and whole milk has 49% fat. But don't be fooled looking at 2% milk, thinking like, oh, it only has 2% fat. No, it has 35% fat. And see how the calorie density of all this is much higher when compared to fruits and vegetables. And when we talk about the calorie density, for the dairy products, it's not just the calories, but the fat, that the impact of the fat on chronic diseases when it comes to dairy products. In the next slide. Yeah, here sometimes when we look visually, it appeals, as well as it's easy to remember. So let's see how the 500 calories of food looks in our stomachs, right? So in the first stomach, you can see oil is barely touching the floor of the stomach. Same with the cheese and the meats, maybe a little bit, but look at rice, potatoes, and beans. So when you're eating whole grains, beans and potatoes, you're filling up your stomach to almost to the top. And not only you're filling up the stomach, but there's been research shown that eating potatoes is very satisfying, and you won't feel hungry because your appetite is satisfied after eating whole grains and potatoes. And when you come to fruits and vegetables, it's almost unlimited, because just 500 calories of these non-starchy vegetables and fruits, without added oils or cheese, see, it can fill up our stomach, but still be 500 calories. And this is a picture from Chef AJ. She displays very nicely how a small cup of walnuts has the same calories as 3 big cups of cherries. So walnuts are great, but this is to show, how the calorie density works. Eating a small handful of nuts per day is very good, but we have to be mindful because look at the calorie density. And when it comes to potatoes, as I said, potatoes are very filling. Yeah, potatoes are vilified. They say like, oh, you potatoes, it's not good. No, potatoes are great. How you eat it, how you process it will make the difference in the calorie density. The potato itself is like around 250 calories, a big potato. But when you process that same potato into the French fries, the calories almost doubled. It became 470 calories, and the salt and all that. And I particularly want to talk about cheese. We all feed our kids cheese and paneer thinking that it's very healthy. I have been there. Being a vegetarian for so long, I thought like, oh, cheese is healthy. It has protein. Paneer is healthy. It has protein. And the more we read, the more we learn and unlearn, uh, you know, it's amazing to see it has as much cholesterol as an ounce of steak. And the cheese is 70% fat. So yeah, we should stop feeding our kids pizza. Instead, we can opt for our traditional foods. Yeah, in the next slide. Yeah, we don't have to deprive ourselves. We can eat all these delicious foods by avoiding oil, by avoiding dairy products. And the first picture is mango lassi made with almond milk and pureed mango, and added some chia seeds for the omega-3 fatty acids and some nuts for all the nutrients. And then in the second picture, it's a custard, not made from milk or condensed milk. It's made from puree of banana and mango, and then added more fruits for added nutrients. And this is our laddu, made from dates and nuts and some flax seeds. Next one, please. Yeah, this we wanted to show this. We made this for Diwali. These are besan laddu, beetroot barfi, pumpkin halwa, and our savory snacks. We can make all these without oil or ghee, and then we can use nuts and dates, and then we can make these savory snacks in the oven or air fryers, as most of us, already have those. Yeah, next one, please. Yes, now I want to take an opportunity to introduce Dr. Deepthi Karanam. She is a nephrologist at Kaiser Permanente and board certified in internal medicine, nephrology, and hypertension. And she is board certified in lifestyle medicine as well. Giving it over to Dr. Deepthi. And I want to mention before that Dr. Deepthi and Metika, they're going to start lifestyle medicine clinic in Kaiser Permanente. And I'm so excited for that. Thank you.
Thank you, Dr. Potluri, and thank you, Dr. Anita. What a treat to the eyes it has been looking at all these pictures, and it's beautiful. The way we can cook traditional foods using no dairy products and less oil, it's phenomenal. And Dr. Potluri, you made me hungry looking at these pictures. They're beautiful, and I can't wait to try some of your recipes.
Definitely. We have on our website. Yes, definitely. Thank you.
And today, now that we have a quick overview on nutrition, and we have heard about how nutrition correlates with chronic diseases, we'll be moving on to kidney disease. So why do we need to talk about kidney disease? It's important because the chronic diseases, all of them, they correlate with poor diet, excess calories, and lack of physical activity. What we eat has an implication on our health. It's the truth. It is very important we be mindful of what we eat, and diet needs to be a vital sign. Vitals does not mean just the blood pressure, oxygen concentration, or the respiratory rate. We need to start looking at diet also as a vital sign, and we need to start paying attention to what we eat. So lifestyle changes can prevent, it can treat, and can also reverse a lot of lifestyle-related chronic diseases. Diabetes, obesity, hypertension, chronic kidney disease, chronic heart disease, all of these can have an impact with what we eat and what kind of lifestyle we are leading. Chronic kidney disease is one such disease, and it's very important. We need to address it, and what better time than now? And before we move on to learn more about kidney disease and the symptoms of the kidney disease, I'm a nephrologist at Kaiser Permanente. And most days in the clinic, when I see patients, they ask me questions like, why did somebody not tell us about it? If we knew about this before, we could have done something about it. So to all of those patients that have asked me this question, this is our effort to let the community know about kidney disease and what you can do to reverse kidney disease and even change the progression of the kidney disease. So an important, what most people don't know, it is not until it's very late that we have symptoms of kidney disease. In the beginning, it just feels normal. Slowly, as the kidney function gets worse, that's when we have symptoms. So there are no symptoms, and the way we find out about it is just by doing blood tests. And if we do something about it, we can change the course of the disease. So that's very important. And nephrology. So what is nephrology? So it's derived from a Greek word. Nephros means kidney, and logy is the study. So the study of kidneys is nephrology. And a doctor that specializes in kidney disease is called a nephrologist. So we need to start out with that. So how many kidneys we have? We all know that we have 2 kidneys. The size of each kidney it's about the size of an adult fist, weighs anywhere between 120 to 150 milligrams. And it's retroperitoneal, it's located in the back. And it's located on either side of the spine, just below the rib cage. So what do kidneys do? Kidneys filter the blood and they help with excretion in the body. So the average amount of blood in the body is about 5 liters. And kidneys undergo the process of cleaning about 300 times each day. So that's lead to a whopping 1,500 liters of blood that passes through the kidney every single day. That's a lot of work that the kidneys are doing, right? So when they're doing all that work, don't we need to do our part? Yes. So the least that we can do to help the kidneys function better is to drink water. And why water? Water is very important because it's the most abundant component of the body. Water comprises about 60% of the total body weight. And with calories and eating bad foods, as we gain more weight and there's more fat percentage in the body, the amount of total water that we have decreases. So obesity, it predisposes to less water content in the body. And with passing years, as we get older, the amount of water also decreases. It decreases because we have less muscle mass, we have increase in the fat percentage, we have changes in the bone density. So with all of this, it's very important now, even with physical activity, we need to focus on muscle mass. We need to focus on keeping the fat percentage of the body low. We need to focus on bone density, do exercises that strengthen not only the muscle, but also the bone. And water is the only solvent of the body in which electrolytes and other substances are dissolved. And coming to the functions of the kidney. So before we talk about chronic kidney disease, so we need to know what the functions of the kidneys are. So the 3 main functions of the kidneys: 1, regulatory function. 2nd is the excretory function, and the 3rd is the endocrine function. So in terms of regulation, what kidneys do, they control the composition They control the amount of fluid we have in the body. They help maintain a balance. So we have acids and bases in the body. They help maintain the balance. They maintain the electrolytes, the potassium, the bicarbonate in the body. All of that is in a homeostasis because of the kidneys. So the second function of the kidneys is excretion. What kidneys do is they remove waste products in the urine. They remove drugs from the body. And they work every day. They work 24/7. There's no Thanksgiving, there's no Christmas. They work 27. And they're doing to get rid of the toxins in the body and to eliminate all the end products. So kidneys also have an endocrine function where they produce hormones. They produce hormones such as renin, erythropoietin, and these hormones each specifically has a function. Renin plays an important role in blood pressure regulation. Erythropoietin plays an important role in anemia and in the red cell production in the body. Kidneys also produce an active form of vitamin D, the D3, which is very important in the regulation of the bone metabolism. So if we look at the picture, here's a strainer. The strainer implicates that kidneys work as a filtration process, and blood cells are being produced, bone metabolism is being affected, and maintaining of acid-base balance. So all of this is accomplished, and the least that we can do to help the kidneys, the first and foremost is increasing the water intake. Water is very important for the body. And why do we need to know about the kidney disease? So 1 in 3 Americans are at risk for kidney disease. We have around 37 million American adults that have kidney disease. More than 50% of them, they don't even know that they have it, because the only way to check for kidney disease is by doing a blood test. If we don't do blood tests, we may never know that we have kidney disease. And 660,000 people, they live with kidney failure. Of all of them, 100,000 people are on the kidney transplant list, waiting to get a kidney transplant to sustain life. The data that I have on the side, the estimated prevalence of kidney disease in India is about 17%. This is data from International Society of Nephrology's Kidney Disease Data Center. And India already has a very high number of patients with diabetes. By 2030, it is expected that we will have the world's largest population of patients with diabetes. And there's a lot of challenges in access to healthcare in India. Because of the challenges that we have, 50% of patients who have advanced kidney disease, which means stage 4 kidney disease and over, they're first seen when their kidney function is less than 15%. That's a very critical number. And to be diagnosed for the first time with a very low kidney function and being told that they have to decide about dialysis, it's not a pleasant situation. And we want to try to avoid it if possible. So the next slide that we are coming over here, this, if we look to the side, it talks about overconsumed foods. So what are overconsumed foods? We all have a lot of added sugars. We have a lot of sodium, a lot of cholesterol, saturated fat, trans fat. Most of the processed foods that we have, if we are eating donuts, fried foods, fast foods, they all have high amounts of added sugars, added sodium, high amount of cholesterol, high saturated and trans fat, which is very bad, not only for kidney disease, but for all chronic diseases. So there's 5 things that we want to cut back from our diet, not only for kidney disease, but for a healthy lifestyle, for weight control, for diabetes control, for blood pressure control. These are the 5 things that we need to start out by eliminating one thing at a time, or even minimizing as much as possible. And so specifically in terms of all the diet, what are the risk factors for kidney disease? So in kidney disease, animal protein, animal fat, and cholesterol, these are very detrimental for the kidney decline. So what they do is they increase the acid load to the kidneys. So the kidneys have to work harder. It's easier for the kidney to process plant-based foods compared to the animal foods. And looking at the pictogram here, diet is the leading cause of chronic disease and disability, not only in United States, not only in India, but globally. Globally, this has become a very big concern. And the next slide here, it's a quick overview on how lifestyle, obesity, diabetes, hypertension, they're all interrelated. They all link to each other. The lifestyle that we are leading, it correlates with chronic diseases. And yes, we can change our lifestyle one habit at a time. If we look back 10 years ago, were we doing the same things that we are doing now? Maybe not, maybe yes. But as each day goes by, even if it's one habit that we think is not helping us, if we change it, that is phenomenal in our overall health. And also for the lifestyle, the diet plays a role, physical activity, sleep, how we are handling stress, what kind of social relationships we have, risky substance use, alcohol, cigarette smoking, all of this affects our health. And the two main causes of the chronic kidney disease is diabetes and hypertension, and we'll know more about it over the next slides. But all of that, they are risk factors for chronic kidney disease progression, eventually leading to fibrosis and end-stage kidney disease. So what is chronic kidney disease? Now that we know what kidney function is and what happens, so what is chronic kidney disease? It is a gradual loss of kidney function over time. So what happens is the kidney function with time slowly decreases. As the kidney function goes down, the kidneys, they cannot filter properly, they cannot excrete properly. So the toxins build up and slowly they make a person feel very sick. They have complications, they have electrolyte problems, and eventually it leads to kidney failure. So when a person is at a situation where they have kidney failure, they have two options, either to proceed with dialysis or to head towards a kidney transplant. And the two pictures over here on the side, so the first one is a normal kidney. And for the normal kidney, it's a healthy glomeruli. The glomeruli, they are filtration units of the kidney. And everything looks good. It's nice and clean. It has a cortex on the outside. It has a medulla on the inside. And this is the renal pelvis, which kind of connects with the ureter, and urine drains into the bladder. So look at the diseased kidney. Compared to a normal one, its appearance changes. The structure of the kidney changes. There's a lot of scar tissue. There's a lot of damage from high blood pressure, from high blood sugars. So the filtration process of the kidney gets disrupted. The tubules are damaged. It just is not healthy because a lot of changes are happening inside to the kidney. Okay, and moving to the next slide, the two main causes of chronic kidney disease are diabetes and hypertension. So they both account for at least 2/3 of cases of chronic kidney disease. So if we are able to control diabetes, if we are able to control hypertension, that by itself decreases our risk of kidney disease significantly. And apart from diabetes and hypertension, what else can cause kidney disease? Over-the-counter pain medications. When we have headache, back pain, body aches, we take medications like NSAIDs, which are ibuprofen, naproxen, Advil, Aleve, Motrin. All of these, when taken in big doses, for a long period of time affect the kidney function. Once in a while, if you take it, that's okay, but make sure you're drinking a lot of water with it. And frequent urine infections, glomerulonephritis, autoimmune diseases like lupus, inherited diseases such as polycystic kidney disease, they all can affect the kidney function. Obstruction is also a cause where kidney stones or tumors in the kidney, enlarged prostate can all affect the kidney function. Kidneys usually don't cause pain unless you have kidney stones. If a person has kidney stones, they're in tremendous amount of pain. And usually in practice, if we ask a person if they've ever had kidney stones and they're starting to think about it, that means they've never had it. We will not forget if we have had kidney stones. It's excruciating pain when the kidney stone is passing. So those are the main causes. The top two things that we need to focus on, diabetes and hypertension, because they cause biggest number of cases of chronic kidney disease. So moving on to the next slide, what are the symptoms of kidney disease? Initially, in the beginning stages, there are no symptoms. There are no symptoms at all. And as time progresses, symptoms slowly start to appear. The toxins build up in the body. The fluid is retained in the body. There's electrolyte abnormalities that happen. So all of these lead to various symptoms. So what kind of symptoms do we have? They're very subtle. They're very non-specific. People can just feel tired. Who doesn't feel tired at the end of the day? They have decreased appetite because of all the toxins that build up in the body. They have vomiting. Their taste changes. They have a metallic taste in the mouth. They have trouble sleeping. And because of skin changes and phosphorus accumulation, they have itching, very dry skin. Some people feel very drowsy. All of these toxins make a person drowsy. They just want to lie in bed all day long, don't want to do anything. And eventually there's swelling of the face, swelling of the hands, the feet. It's just water accumulates in the body because the kidneys are not able to eliminate, and it accumulates in the heart and the lungs, just all over the body. When kidneys are not working properly, and because of electrolyte abnormalities, we can have muscle twitching, have just pain in the muscle, arrhythmias from irregular rhythm. All of this can also happen. Okay. So how do we know we have kidney disease? The only way kidney disease can be detected is by blood and urine tests. So it's very important to get testing done. Otherwise, we cannot estimate what a person's kidney function is. So what kind of blood tests? So one is BUN, it stands for blood urea nitrogen. And the second one is the creatinine, which is the marker of kidney function. And the third one is an estimated glomerular filtration rate. It's a big word. It goes by GFR. So if there's two things in your blood test that you want to look at to know what your kidney function is, it's creatinine and GFR. The GFR spins out a number. That number is an estimate of the percentage that your kidneys are working. And also in the urine test, we check urine for albumin. Albumin is a type of protein. We check the urine for creatinine, and urine albumin to creatinine ratio, it's a ratio that quantifies the amount of protein in the urine. Protein, they're building blocks to the body. So we need it in the system. We don't need it in the urine. If a person is losing protein in the urine, that means their kidneys filter is damaged. The kidneys are not working properly. So the more protein we lose, the faster the kidney function will go down. So look back at your tests and look at the creatinine, the GFR, know if you're spilling any protein in the urine. These are all important things. So apart from the basic tests, kidney ultrasound, a renal ultrasound, it tells us about the structure of the kidney. If a person has any kidney stones or any kidney cysts, and cyst is usually a pouch that comes from the surface of the kidney. So these are all detected on an ultrasound. It's more for the structure of the kidney. And in some cases, we may need to do a biopsy of the kidney, where a piece of the kidney tissue is taken and analyzed under a microscope to see what the diagnosis is, but that is done in specific cases. Okay, and moving on. So now that we know what are the causes of chronic kidney disease, what are the stages of chronic kidney disease? There are 5 stages of kidney disease, and 5 is where we don't want to go. 5 is usually when the kidney function is less than 15%, 1-5. So if the kidney function drops below that, we are in kidney failure, and that's not a good place to be at. So based on the other stages, the stage 1 starts out where the kidney functions 90% or higher, which is very good. Stage 2 is from 60 to 89%. Stage 3 is from 30 to 59% of kidney function. And stage 4 is from 15 to 29. If we look at this pictogram on the side, as the protein in the urine increases, the risk for kidney disease increases, and kidney disease can progress very fast. So likewise, from top to bottom, stages 1 to 5, we turn from low risk to intermediate to high to very high risk. So a person with highest risk is somebody that's spilling increased amount of protein and has very low kidney function. The risk of progression of the kidney disease increases with each stage. Okay, and moving on to the next slide. So when a person is in kidney failure, which is defined as less than 15% of kidney function, there are 2 things that we can do. It's called renal replacement therapy. One is dialysis, and the second option is a kidney transplant. So there are 2 kinds of dialysis. One is a blood dialysis, which is called a hemodialysis. And the second one is a peritoneal dialysis, where a catheter is put into the peritoneal membrane, and the person can do dialysis at home at their convenience. Again, dialysis is not the best modality out there, but it's life-sustaining. So when we get to that stage where the kidney function is very low, that is a treatment. So kidney transplant, the average wait time is anywhere from 5 to 7 years, and kidney transplant is also an option when we have end-stage renal disease. So now that we spoke about all the bad things, and now we need to talk about what we can do. If we have kidney disease, how can we change the course of the disease? If we have diabetes or hypertension, do we have kidney disease? How do we find out about it? So all of that is important because, yes, we can change the course of the disease. There is extensive scientific evidence which supports the use of nutrient-dense, antioxidant-rich, which means we need to eat foods that have a lot of nutrients in them, that have a lot of antioxidants in them. A whole food, plant-based dietary pattern is recommended. So what is whole food? Whole food is anything that does not have an ingredient list in it. So if you pick up a box and look at it, there are 10 ingredients, it's not a whole food, it's a processed food. So we want to stick to simple foods that don't have too many ingredients, don't have too many things added to it, don't have the nutrients taken off from it. And the other things that also help is decreasing salt intake. We all know salt is very bad for hypertension. Likewise, salt is not good for kidney disease. We have to cut back on the salt usage, cut back on the oil. No oil is even better, and cut back on animal and dairy products. Like we have mentioned in the previous slide, animal products and dairy products, they're high in saturated fat, and that's not good for the kidneys. We also need to increase the fiber intake in the diet. So, for example, in terms of oil, a teaspoon or a tablespoon of olive oil has about 120 calories in it. It has about 14 grams of fat in it. When we are cooking foods, we are all used to doing the tadka. You do the tadka. If you add 2 tablespoons of oil to it, that is 240 calories and 28 grams of fat added right there. So we are taking all of these vegetables and good things, and we haven't even started cooking, and there we go, we've put in 250 calories into the pan. So we want to cut back on oil as much as possible. Again, eliminating is good, but at least try to decrease the amount that we are using. And fiber, Dr. Potluri has already mentioned on how fiber affects the overall health. It decreases breast cancer. It decreases the incidence of diabetes. Fiber is very important to decrease the incidence of diabetes. People that eat a lot of fiber, they have less risk of diabetes. So plant protein versus animal protein. In the first overview about nutrition, we saw pictures of what foods have more protein in them, what foods have more iron in them, what foods have more calcium in them. And we already use a lot of lentils, beans, vegetables, and all of that. So with our culture, we already have all of these good things. We know how to cook them. It's not that we pick up some lentils and we have no idea what to do about it, right? We all know how to cook lentils. We just have to modify the cooking techniques slowly, one thing at a time. Do only what you can. Just because you're listening to everything we are seeing, that doesn't mean you turn off and you go and throw everything away. But let's start one step at a time. A cup of red lentils has about 18 grams of fiber in it. Edamame, black beans, almonds, peas, all of these things have high amount of protein. If we compare it to the animal protein, they are no less. Our lentils and beans are no less in the amount of fiber and the amount of protein in the diet. Animal protein has no fiber, high in calories, high in saturated fat, high in cholesterol. So when we are getting foods, we have to look at it as a whole package, right? Let's say dairy has a lot of calcium in it. Excellent, very good. But it's the highest amount of saturated fat in it. So what we can do is we have to try to find other sources that has calcium and that does not have a saturated fat in it, right? So we can't go by just one thing. We have to look at the overall picture and see food as a package, what good it's bringing to us. So animal protein increases the acid load on the body. So eating a plant predominant diet is very important. And okay, if we looking at this, these are all pictures from Plant-Based Los Angeles, Dr. Potluri and Dr. Anita's webpage, and they've done a phenomenal job. They have great recipes. They know how to tweak foods around to increase the nutritional value. And look at these plates. If we just look at them, there are whole grains in them. There's fiber, there's green leafy vegetables, beans, lentils, nuts, seeds. And again, these pictures that we are looking, they're not some fancy things that you have to go to a cooking class to learn, right? These are things I can do, you can do, we all can do it. They're black-eyed peas, lentils, greens. So the one thing from this, if you need to get, is let's change the way we cook just a little bit. for better health, and for better quality of life. So now fiber is found exclusively in plant foods. And we already spoke about food groups that have high in fiber. What I would like to emphasize is if we increase our fiber intake by 5 grams per day, that decreases the incidence of kidney disease by 11%. So if there's 2 take homes from my presentation for today, drink a lot of water, eat a lot of fiber. And these 2 things are doable and very easy to do. There was a study that was done that was published in the British Journal of Nutrition that says high fiber intake, like 33 to 35 grams of fiber, compared to low fiber intake, has significantly decreased the incidence. 53% decrease in CKD incidence by high fiber. So aim to eat anywhere between 20 to 40 grams, ideally somewhere in the 30s is a good reference point. So this picture, again, tells us what America or what we are eating now. Again, not necessary all of that, but if we look at this plate has processed food, it has saturated fat, it has trans fat, a lot of sugars, animal meat, animal protein, animal fat. By eating foods like this, we are increasing our risk for obesity, diabetes, hypertension, kidney disease, and heart disease. Poor nutrition is the leading cause of death globally. If we change to a whole food, plant-based eating, it doesn't have to be a specific kind, but whole foods. When you're buying foods, when you're eating foods, look at them. A whole food is a food that is in its whole form. Like apple is a whole food, but an apple pie is not. We have taken off most of the nutrition and added everything that the body does not want and turned it into an apple pie. Again, it tastes good, but we need to focus on what we are putting in our mouth. Just be mindful of what we are eating so we can have better health. So I'll end my talk with these 2 pictures up here. Your kidneys clean up your system to keep you alive. Let's clean up our diet to help them, right? The least we can do, it's not too big that the kidneys are asking us. We just need to clean up our diet. And change is possible, each one of us. Stones are the only ones that don't change, but otherwise we're all humans. Somebody once told me that you can change because it's possible. And we have to do one thing at a time, even if it's one small habit or one small thing that is not going with us, we need to change it. That's very important. And focus on your diet, focus on activity, walk more, focus on your stress, find ways that make you happy. Again, laugh more, worry less, and to a better health. Wish you all a happy new year. And thank you. So the next part of the presentation is going to be Dr. Kanabar. And Dr. Kanabar and I are colleagues. We work for Kaiser Permanente. She's specialized in addiction medicine and lifestyle medicine. And moving on, here you go, Dr. Kanabar, you're on the stage.
Yeah, thank you, Dr. Deepti. That was a really illuminating talk. And I mean, you really brought it to the point. Like when the patients come in, they're always asking about the cholesterol level, or how is my blood pressure or hemoglobin A1C. They, even if I tell them, you have protein in the urine, they don't even, it doesn't affect them. I really take time to tell your kidney function tests are, they just say, oh, it's only 0.2 per 0.2 is high. So I hope listening to your talk now, all the viewers will find out about their kidney health. And then, and now, I'm so excited and happy to introduce Dr. Mithika. She works as an addiction medicine doctor in Kaiser Permanente. She graduated from the prestigious Stanford University, and she serves in different roles at the California Society of Addiction Medicine, and is also part of is a committee member for international collaboration in addiction medicine. She's also a faculty at USC. She's not only going to help us understand the tech and alcohol addiction, which no one talks about, especially in our community. And she'll also be talking about the mental health in Indian culture. We are so lucky to have you here, Nitika. Go ahead.
Thank you very much, Dr. Kankar. Let me go ahead and share my presentation. All right, can you see that?
Yes.
All right, so let's get started. We will hold on. We will. Can you hear me? Okay.
Yes. Yeah.
Okay. All right. So let's talk about technology overuse and substance addiction. So, just to get started, what is addiction? So, addiction is a chronic, relapsing, remitting disease of the brain. What happens is once you use a substance, let's for say example, you're smoking a cigarette, you have that high that you get from smoking. And then once about 30 minutes to an hour later, you have the withdrawal. You feel like, oh my goodness, that high that I was having or that calm that I was feeling is going away. And then starts the cycle waiting for the next time you can get out of the house and have a smoke. So that is called preoccupation or anticipation. At some point, you will go ahead and go outside, have a smoke, and then the cycle starts again. So initially this may start as like, a couple of friends said, let's go, let's do one sutta or let's have a smoke. And you think that, one is okay, what is going to happen? But at some point, maybe in a few days, maybe in a few months, you will stop having the ability to say no. The addiction has overridden your brain and taken away the ability to say no. And that is when you have a bigger problem and that needs help for. So let's talk about alcohol. Over the time, as you might have seen, whether it is in our cinema or in our culture, alcohol has been normalized compared to what it was 30 or 40 years ago. At the same time, we don't really know what we are signing up for because we don't know what the alcohol normal limits are. So, one standard drink is about 12 ounces of regular beer, 8 to 9 ounces of malt liquor, about 5 ounces of table wine, which is like about one bottle is about 5 drinks, and 1.5 ounce shot of distilled spirit that can be gin, rum, tequila, vodka, whiskey, and so on. So these limits are kind of from the NIAAA and from the NIH. Now, as far as dietary guidelines for Americans are concerned, what they say is if alcohol is consumed, it should be taken in moderation or by a legal drinking age person, up to 1 drink a day for women and up to 2 drinks a day for men. So about 7 drinks a week for women and 14 drinks a week for men. And this is kind of like the unhealthy alcohol use sort of definition. So when people ask me what should be an okay amount of alcohol to drink, there is, I would say the lower the better, maybe 1 or 2 drinks a week. But even if you can avoid that, I would say if you're cutting back, you would have to maybe pre-designate 1 day a month that you would drink alcohol and the other days you would not. So what is a binge? So if you have, for a male, if you have 5 or more drinks in 1 day, then that's considered a binge. For females, it's about 4 or more drinks in a day. Now, what we see in the Indian population is that people tend to use more binge drinking alcohol more than daily use. So this is of importance because after a number of binges, you are going to get hooked and you are going to need more binges through the week. Now, as far as, when you go to a doctor, this is kind of like the standard questionnaire you get given. And they talk about any binge drinking. And the other question is like, if you've ever tried any recreational drug. And if it's a yes, no question, if and then depending on your answer, you will have a chat with your primary doctor and you will discuss more about it. So why is all of this important? The reason this is important is when we are, as adults, are using alcohol or any substances, we are always being watched. Who's watching us? The kids at home. Now, if you have kids, you know what I'm saying. In the smallest thing, they are going to notice, and they notice everything very well. At the same time, the same media that you're watching that completely glorifies alcohol use, they are going to be, say, watching the same things on TV with you, just for an example. Now, there is a survey called Monitoring the Future survey. It's done by University of Michigan for the NIDA, and that records drug use and alcohol use in 8th, 10th, and 12th graders. And according to them, 1 in 3 children starts drinking of by the end of 8th grade. Half of them having reporting being drunk. So this is really startling, because the brain is still growing till 25 years of age. And if you try substances before the age of 25, you have a higher chance of getting addicted to them. So you think about it, this is kind of half of that age, 8th, 10th, and 12th grade. If they are actually drinking enough to get drunk, they are going to have a higher chance of being addicted to alcohol or other substances in the future. So let's kind of go back to the beginning. Now, is alcohol use prevalent in the US? Absolutely. Is alcohol use prevalent in India? Absolutely. Now, the problem in India is there are a lot, like every, of the, 5.7 crore problem drinkers, about 3 crores are dependent users. So this is a very high number, and there are not as many services available. In the US now, gradually we are having more services available. Now, why do people use? Generally, it's kind of when you are a teenager or in your 20s, you start with because, just try it. Your friend says, kuch nahi hoga, I have done this all the time. And then you will hear also some adages saying, oh, my grandfather drank every day till 95 and he lived just fine. Nothing's going to happen to me. And the most common thing I hear is alcohol is the way I detox after office. I did so much, I achieved so much in my life. Of course, I can take a few drinks after work. I deserve it. And then when do people use, So we talked about it. So in teenagers and then social events. Now, whether you're getting together for a birthday party or for a wedding or for whatever, have alcohol available at these venues. And this is kind of normalized way of enjoying a festival. And, the problem is when it graduates to daily drinking or frequent binge drinking, that's a problematic use. So when you say that, hey, I've been drinking maybe 2 or 3 binges a week, and your doctor says, hey, maybe you should try cutting back, because that's the way, right? You would not know how bad it is unless you try cutting back. If you're cutting back and you're doing fine and, you want to work on your liver and you're able to cut back and watch your liver improve, that's amazing. That is the outcome we are looking for. But, if you have a lot of questions about cutting back, then we know that we have a little bit of a problem on our hands. So what are the questions that I get? Like, how will I hang out with my peers? Who will come to my house party? This is going to be the most boring party on earth if I'm not drinking. And I cannot look cool because that's the only way to look cool. And all of my friends like to party. Will I be alone? So this I get a lot. You can imagine from every age group. Because once you use a substance, be it marijuana, be it alcohol, you kind of surround yourself with people who use alcohol, who use marijuana. And then your worldview kind of gets shifted, saying everybody uses alcohol. And if I don't, I'll be the odd duck out. No, that's not true. You need to have a varied friend circle. And that's kind of a process of realization that you have to go through. Now, especially in our culture, we never talk about, alcohol use or problematic alcohol use. Whenever something like this happens, everybody is trying to rug sweep or, hide it away like, oh my goodness, what is going on? You know, from family, I generally hear, but he doesn't really drink that much. He's an amazing person. How can we actually talk about this? He will feel bad, or what will he feel? And then the whole family unit kind of surrounds us one person who has a problematic behavior with alcohol use, and nothing gets done about it until it is too late. Now, one thing you have to remember is the sooner you address such things, sooner you speak truth to power, sooner you get help, the better. You should be that person who gets told by the doctor, hey, you have a little bit of fatty liver. It could be related to alcohol. If you cut back, you'll do great. And you cut back and you do great. That is the success story we are looking for. other than prevention. Prevention is absolutely the best, as all the speakers have said before me. So the other thing is, if a person needs help for whatever reason for addiction, then the next thing is, log kya kahenge? What will people say? Yes, this cannot happen in our family. This is not going to be the image that I want to give out in our society. The other thing I hear all the time is, it's all in her mind. Only if she walked twice a day, she would stop drinking. You have to understand that at the time when your addiction has progressed so much that you need medical help, it's not something that's going to be an easy fix. And think about it in a converse way. If she had a fracture, if he had a fracture, would you not get the best cast or best help available? You would. So I tell my patients, think about it, that you have a fracture, that you are going to be in bed for 6 weeks. You have to take it and you have to, make the best of it. Our families are eager to choose whether the cast should be pink or purple in color, but not willing to go to the appointment to see the doctor to get help. So this needs to change. Sometimes, friends can be helpful. At least over here in the US, I hear people saying, hey, I reached out to my friend and he knew a friend who knew a friend who was in AA or who's done this before. But in India, so much, it's not very usual to get help, and friends kind of try to avoid it. Hey, I don't know, you have to figure out your way. I wish you all the best. So we have to understand what are the resources available, and so that we can even guide others who are in such a situation, because it is a really bad vicious circle to be stuck in, and these patients need all the help that they can get. um, Other thing would be, like all of these Hollywood movies, 28 days and so on, have this romantic idea that you go to rehab. It's for 28 days, you come out and you are all changed. It's actually after you come home that the big battle begins, because you're going to have the same triggers at work, same triggers on the way home, same safe way on the way that you can drive to and pick up that bottle of alcohol or whatever it may be that you do. And so just send her to rehab or send him to rehab is not the answer. It has to be a full family and friend kind of support system, and finding sober supports for the person. So what kinds of help are available? Definitely, there are many levels of care. There are inpatient levels of care, outpatient levels of care. There are different kinds of support groups available. I would first of all like to say is that do not stop any substance whatsoever without physician guidance, because abrupt stopping can have serious medical consequences, including like needing ICU hospitalization or even unfortunately death. So you need to get medical care just as you would for any other disease that you may have. There are fellowships available like Alcoholics Anonymous. And what I was surprised to see online in YouTube is that there is AA material available in pretty much all Indian languages. And that's amazing that that fellowship is now available in India as well. And there are institutions, whether it is in the US or in India, that are leading the fight against addiction. One of the hallmark studies that came about in 2019 was this All India survey done by AIMS and JIPMER and other medical institutions that estimated the amount of drug and alcohol use in the country. And that was landmark, and that has guided policies in the future. Now let's talk about marijuana. So, with legalization in the US, kind of India is also catching on, and everybody has this idea of marijuana being this innocuous drug that everybody can take and get away with. Everybody wants to have that golden limitless pill, like the movie, where you can do everything you want and not have any consequences of use. So, what is the marijuana? So, we all know about, in Holi, people try using some bhang and then generally throw up for whatever reasons. But now it has become much more sophisticated. There are wax pens available, and they're much more concentrated forms than ever before. So what you will hear people say is that the weed that was available in the 60s is completely different than what's on the streets right now, because even the flowered kind is genetically modified. So all of these things are programmed to give you a bigger hit and also be more addictive. So we need to be careful about what we use, and especially with teenagers. It is going to decrease your brain function or IQ levels later in life. Now, looking at the Monitoring the Future survey again, this is from 2019. I apologize for the slide. Basically, um, there has been a high prevalence of marijuana use in teenagers in the 8th, 9th, and 12th grade. One of the things I do want to touch upon is sleeping pills. So sleeping pills can be benzodiazepines like Valium, Ativan, and so on. And back when these were discovered, they were targeted towards women. Like women had everything on their shoulders, be it work life, home life, doing the laundry, doing everything, and no help. And so they would give these sleeping pills, and so that they would not have as many complaints with their anxiety and stress levels. Now, unfortunately, what happens is once you've used like a sleeping pill daily for as little as 3 days, up to 3 weeks, you can get hooked to them. That means it no longer works for giving you sleep, but it gives you the mirage of this is helping me sleep, but it doesn't really work that way. And these are one of the things that should be tapered only with medical guidance and very slowly. And you can see that in India, Uttar Pradesh and Maharashtra are leading the problem of sleeping pill use. Now let's switch gears. With all of this talk from Dr. Potluri and Dr. Karnam about food and recipes, we are all envisioning a nicely laid out table full of whole food plant-based foods that are also traditional and have all the spices. Now, this is once upon a time, this is how we would all sit to dinner, right? The whole family sitting down together and breaking bread. And now think about this. So this is unfortunately too common, and all of us are guilty of having done this. Is taking some other distraction to the table with you, and not really paying attention to the food that we've been privileged to have on our plates in front of us. And most of us can identify with this. So what is going on? It's kind of almost as if we are shackled to our phones and our computers. First of all, with COVID, everybody had to start working online. And so suddenly you have to be accessible in a number of different ways more than ever before. But other than that, all of these apps and services are designed to be addictive. If you were an entrepreneur who has launched an app, you would want your app to be successful. That is how you design it. So they are always like 2 steps ahead of the game. So some of the things I hear from patients, oh, I need to check whatever the latest WhatsApp status is. Did you see that? And it's like, no, I don't know. Did you read the news? So this with the news, COVID was especially problematic. Every day you got something more scary to read in the news or on your WhatsApp or on your YouTube or Twitter or whatever else social media that you use. The other thing is, you try to engage in that sphere. It's kind of like a different world in itself. And you would say, I posted it 3 hours ago. Why don't I have a like till now? I will also not like the statuses of these people in the future. And without being aware that it's like, maybe around midnight and they might be asleep unlike you. We don't consider that. And then, you will definitely hear the story. No, I was just checking my phone for 2 minutes. And then it's already like, I've missed my dinner. It's already been a couple hours. That's very common. And then some people say, hey, this is the only way I can de-stress. I like reading social media. It helps me de-stress. But does it really? That's kind of a question that you have to explore for yourself. So one of the things before moving on, I would say is that if with this cohort with Dr. Kankar and Dr. Potluri, if you were interested in a digital detox, we can definitely consider talking more about this in the future in one of the 8 weeks. How to start incorporating lifestyle changes. Now you've had this whole lot of information from Dr. Kankar, Dr. Potluri, Dr. Karnam, and now me. Now what do you actually do about it? So the initial reactions, including mine, were like, I don't have time for this. Like, this is learning a whole bunch of new things that maybe I do not have the time for. Other thing is this will cost too much money. Immediately we go to our perfectionist self, like we feel like everything has to be organic, brand new, and we are doing it right now. Not really so. You have to do small things and one thing at a time, and do what you can at this point. Even if there's only one day a week where you have the time to do something different, think about it, do it. It starts with one day a week, and then you go to 2 days a week, 3 days a week, and so on. The next question is who will eat that food. So now most families have like, oh, so and so likes this, he likes that, especially in our culture, right? And you think that, oh, I will cook this and then nobody will eat it and it'll go to waste. And you are envisioning that you're going to live on grass and fresh air, which is why I put the photo of the grass. And that's unfortunate. That's fortunately not true. We all have all the beautiful recipes available to us, and we can use our traditional foods as well. I will miss my mithai, I'll miss my chocolate, I'll miss my fried food, I'll miss my pav bhaji. We are now thinking about all the tastes that we like on our tongue, and we feel like we are going to live a life bereft of that. The most common thing I hear is, oh, if I don't get to eat this, it's not worth living. And really, is it so? You know, that, and you have to ask the question, why do you feel that way? What will we even eat? And my pantry is full. I already spent so much money. Will I throw it away? And these are the questions that are very common. How can you eat like this every day? How can you do this forever? Now, one of the things again is, what will people say? It's embarrassing to go to parties now because then I can't eat this or that. And one of the things I hear from women is like, how can I make all of this healthy food just for myself? I am a Maharani or a Maharaja, whatever be the case. I can't make my own separate food and then cook something else for the elders and cook a third thing for the children. I will never get out of the kitchen. So this is something I want you to hold up over there. We are thinking about helping the health of everybody, whether it's the elder generation, whether it's our generation, whether it's the generation of the children. Because again, children are watching. They actually will learn how to cook and feed themselves if you do this the right way. And that is worth any insurance or whatever else you can buy. You're getting this health, you're giving them the gift of health, and that's what you should consider first. So how do you kind of recenter yourself? Like all of this information is looking at you. I would say, first of all, you have to be in the right time in your life to try. If you are a student who barely is making, ends meet and, having student loans, and you have so many other things, you can try with like one meal a week that you can do in a different way and small things. And there are definitely lots of cheap bean options, other things. You have to try according to the stage of life you're at. If you already have an assured income, a good home, then you have more possibilities. But unfortunately, at that age, you also have this thing about, well, uh, I get my meal delivery service. My meal delivery service is not going to do this. That dabba wala is not going to cook this way. Think about it. This is about your health. You have to take the reins in your hand. It is about what you would like your life to be. You have to imagine the possibilities. You have to have the power to dream. It is, let's try to dream and let's try to get there. Um, having done this myself, I can definitely say your body and mind will have positive changes with you giving this a try, because your taste buds are going to evolve. You're going to start appreciating even the subtle changes in tastes, instead of having like completely, I don't know, foods that are in your face with the taste. You're going to start appreciating more gentle notes of flavors and fragrances. You will start eating with all your senses. Uh, this is a lifestyle change. It's not a wonder drug. I think that is the biggest problem that comes, because everybody wants to hear about the pill that you can take that will make you better. Well, there is something that you can do to make you better. It's unfortunately not a pill. And I think that's also fun in that. Um, One thing with all of this, you have to be very, very clear about, especially when you're talking to your family, your children, is never label foods as good or bad. Because every time we've had all of these conditionings, like, oh, the milk is good because we've watched all the doodh commercials growing up. That is wrong. You have to understand your body, what it needs right now, and you just have to be mindful what it is that you're putting on your plate. And once you eat for the purpose of nourishing your body, instead of talking about healthy, not healthy, and whatsoever aspersions you may cast on the food, you just have to regard it as food to make the machine that is your body work better. The reason I say this is because all of these fad diets have consequences. First of all, people still keep struggling with their weight. They have constipation, they have acidity, they have joint pains, and they feel like they tried all of these healthy things, never got any results. Why will this make a change? Well, That's the approach. The approach matters. As far as children are concerned, you have to be very wary about how you talk to them about food, because it's very easy to develop eating disorders. They're constantly bombarded with all of these images on social media, on TV, about what healthy looks like. And it could be anorexia is the healthy. So even if you are thin, you look in the mirror and you feel like, oh my goodness, I'm so fat, or I have this problem area. And don't talk about your body like that. Give respect to your body, give respect to the food in front of you, and just get through life in a very gentle manner. So one of the things I would like to bring up is, if you were on any Desi WhatsApp groups through COVID-19, you got all of these memes like, oh, I ate so much in COVID that I can't leave, get out of my front door. It might seem funny in one way, but at the same time, it's also body shaming, and that's not okay. So we have to understand what are an okay joke, what are not, especially because it's going to it's going to keep it's going to give you inhibitions about yourself, and especially kids will get inhibitions about themselves, and that's not how we do. Unkind talk is not okay. All right, so let's talk about mindful eating. Now, what is mindful eating? Mindful eating is, eating with all your senses. You have to, it's kind of understanding how a baby who's breastfeeding from the mother, she knows when to stop breastfeeding, when her tummy is full. She knows when the cues are. And that is basically what is mindful eating. Now, we have this already programmed into our brains, but unfortunately, over time, what we've done is we've had highly processed addictive foods presented to us. We have been almost conditioned into eating with having the TV on, or having the phone on, or watching a video or some sort, or standing up and eating and being distracted. One of the most common things in residency was I would be doing charts and eating soup with my left hand and typing with my right hand. That's never. We have to break that super conditioning and go back to what our brain inherently knows: is what kind of food do I need, what it is that I need right now, and how am I going to eat it. So, one thing that is common in most cultures is saying grace before starting food. And we have such a prayer that we can use since we are talking with the temple. I hear that at your temple, the children generally say Govinda and start eating. And I found it super adorable. And anything that makes us aware of where we are and what we are about to do is great. So I like this prayer. It's from the Gita. It says, Brahmarpanam Brahmahavihi Brahmagno Brahmanahutam Brahmevate Gantavyam Brahma Karma Samadhina. All right, so let's talk about mindful eating and let's talk about our culture. So these are a couple of wise sayings. I'll start with the first one. Koruk, koruk, koruk. Hitabhug, mitabhug, jitendriyo niyataha. That means, who is healthy? Is the crow is asking you who's healthy. And the answer is the one who eats to nourish the body, the one who eats moderately, the one who eats with senses under control, and the one is going to be healthy. This is the person who's going to be healthy. And the next line is generally also walks 100 steps a day and sleeps on the left side. But for our purpose today, it means eating mindfully. All right. What is eating mindfully? Now, I love this one because I was the person like, in Indian summer, you go home and you want to eat, but you just came back from, playing outside or from school and it's hot. And first thing you want to do is down 2 cups of water, and then mother will shout like, no, 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 you need to eat first before you fill your tummy with water. Well, now I have an answer. Purayet anne nardam trutiyam udakena tu vayos sancharanarthaya chaturtham avasheshate sheshayet. Half of the stomach should be filled with food, third part with liquid, and the fourth part should be left free for gases to move around. And this is also important because with the habit of eating processed food, we have a tendency to eat till we are over full because we are too distracted to know when we are really full, and we stop too late in the process. All right. So going to the Bhagavad Gita, what are the foods for goodness? So there are three modes of nature: rajas, tamas, and sattva. So sattva is a person in the mode of goodness, and there are foods that are juicy, succulent, nourishing, and tasteful. These are basically um, fresh whole foods that we are talking about. Foods that are too bitter, too salty, very hot, pungent, dry, chili food. So this is all the foods that I generally like when I go and eat outside. And they are more rajasic, and they are not helpful. And foods that are overcooked. So this is something, unfortunately, we have to get used to living in the US, is like cooking for the week, batch cooking. The fresher the food you can eat, the better for you. Um, so there are a couple more things about, how you can be balanced. What is work-life balance? So I like this one below, which says, who are temperate in eating and recreation, balanced in work, and regulated in sleep, can mitigate all sorrows by practicing yoga. So that means, the people who have achieved the pillars of lifestyle that we have briefly talked about and are balanced in whatever they do, they can actually attempt to do yoga. All right, so let's talk about yoga or yoga. I like this definition of yoga because it pinpoints directly to, our culture, which always has had this open mind towards mental health, but unfortunately in recent years has gone away. So this is the second line of the Patanjali Sutras. It is yoga chitta vritti nirodha. That means yoga is the the state in which you are calming down your mind wanderings. And this is very astute, and most of the sutras are actually about how to calm your mind down and what why am I here, what is the purpose of life, those kind of questions. A small amount is about asanas and the pranayams. I really like this other one, which is chitta chinta samahi ukta bindu matra visheshatah sajivam dahate chinta nirjivam dahate chitta. All right. So it says between chitta and chinta, there is only a dot or a na that separates the two. Otherwise, they are similar. Chitta is the one that burns the funeral pyre. Chinta is the one that burns your mind day in and day out of your life. So the way it talks about anxiety, I think that we've always had this culture about talking about mental health forward, but what has happened over the years, for whatever reason, is that culture is lost. We need to now, in today's day and age, we have so many medications, so much therapy, so much help available. We need to open our hearts and minds and accept the help, so that once you are stabilized, you can achieve better things in your day-to-day life. All right. I want to touch a little bit again about the kind of information we've had throughout last year and the amount of anxiety and stress everybody has felt. It feels like, oh my goodness, the world is going to fall apart every day of the pandemic, and people have had different sources of information and have reacted in different ways to it. I like this shloka from the Bhagavad Gita, who said that you have to be there should be equanimity in how you react to situations. If you feel that a stone as well as a piece of gold are the same, and you react the same way, when you have control about your reactions in the way your emotional mind and the wise mind are balanced out, and you have a rational reaction to most things, you are going to be better off. So one of the things about technology, especially using social media, is like, you put something out there and you feel like, why am I not getting a reward or like, or, points or whatever that may be. And I like to go back to the gist of the Gita is karmanya vadikaraste ma phaleshu katachana ma karma phal hetur bhurma te sangostva karmani. So that means, when you only have the opportunity and to do your karma. Okay, some people translate it as right. No, it's opportunity. But you do not have the opportunity. You do not have the right to expect a reward. But at the same time, because okay, if I do something, I should not expect a reward. Why should I do anything? I should just sit in one place. No, you should also not be attracted to inaction. And then, you know, the follow up to that is be steadfast in performance of your duty. Okay, abandoning success and failure, you should stop looking at it from that way. And when you have equanimity in this way, it is called yoga. All right. And all of these things are in a way mohamaya, whatever we see, right? When you interact crosses the quagmire of delusion, you will then acquire a difference of what has been heard and what is yet to be heard. And I think this is very true with like all of the things that we see on various social media all the time. All right, so I'm sure Pandit ji will be able to talk more about these shlokas than I would ever be able to in my life. But thank you for the opportunity. Now let's talk about taking the plunge to living well. And I found this very astute. Among the ignorant, a well-read person is better. Amid the well-read, those who have a grasp of material are a blessing. And amongst them, that have assimilated the knowledge are better. But most of us have this knowledge. We've heard all of those things. Among those who have assimilated knowledge, those that put it to practice are deemed the best. So let's try and think about putting it to practice. Do you think we can do it? I think so. And hopefully with the temple, we get a tathastu.
Thank you, Dr. Kanabar. That's an excellent presentation. We learned many aspects of addiction. Actually, it's very interesting and eye-opening in a manner, like how the sleeping pills and how the teenagers are being, addicted to drugs early on. And it's amazing to see like how our Indian culture allows us to take care of the mental health. So how it's been an integral part. Thank you for letting us know. And we had all these slokas from our sages from millions of years back. And I love the picture where kids are sitting down and eating mindfully. It reminds me of Krishna temple, where kids, everyone sit down and eat. As a matter of fact, that's one thing I'm missing. Our family is missing is visiting the temple in this COVID times. And thank you for an excellent presentation. And now Dr. Anita will be talking about exercise and medicine. I and Anita also met in the temple like 14 years back, and we are grateful and thankful that we are doing this presentation for the temple. It's all yours, Anita.
Everyone, hi again. I'm sorry, we know it's very late, but we wanted to take this opportunity and, give it out to you guys. So we'll record it and split it into different smaller pieces so you can share with. So exercise, we already know. I'll keep it very short, but I just wanted to say how important exercise is also like medicine. Like this simple lifestyle changes with exercise is actually better than taking metformin for the prevention of diabetes. So that is one important thing I wanted to say. And then exercise doesn't mean going to the gym, even physical activity. If you do enough physical activity, that itself will prevent a lot of diseases. And exercise is mostly planned, and you do repetitive movement. So physical activity will make you, why it's important to have better to do this exercise and activity is like it'll help you do your chores, and then when you grow older you can be independent and you can be in better mood, so those kind of things. And this one actually shows it's a study done where people with who have TV, they have higher mortality than people without the TV, and even who are not, they're not even exercising. Like I hear a lot of time from some of my patients that, the mostly IT workers, they're in the office the whole day and evening they go to the gym and come, and then it's not helping. So that's the reason. That's because every hour or every 30 minutes you have to get up and walk. So that's what this study actually says. So it's not just going to the gym. I mean, it will help, but this is what is more important. It's called non-exercise activity, thermogenesis. It's neat. So anything, that's why if you don't have TV, you have, if you're not sitting in front of the TV, you'll be doing these other routines, So gardening, cooking, any of those things. So like I was just talking to my dad yesterday, and, so I was telling him, when I call you, you have to start walking, So when you pick up a phone, start walking, or do any of the activities. So every 30 minutes, if you're having a sedentary job, please get up and, stretch for 2-3 minutes and make it a routine. Nowadays, even our, these eye watches actually give a indication to do that. And even these are all not just like, oh, exercise is good. Whatever in lifestyle medicine, what we are advising or suggesting, it's all is supported by strong scientific evidence. So you can see so many things. It's not just for heart disease or, it helps in dementia. Sorry, one second. And reduces cancer risk and a lot of chronic diseases. And in addition to the bone health and cardiovascular disease, which we already know. So there are different kinds of exercises. We all know about aerobic and all that. So, but strength exercise is very important, especially if you're after 50 for women, because as we grow older, our bone density, we start losing bone and muscle mass. So you have to start. So please start even earlier, like our yoga and all those are, they all help in this. I'm going a little fast. We are going to do these 8-week classes. So that's why we'll, touch on each individual one. So the most important thing is it doesn't mean that we have to go for hours spent in the gym and all that. It's only 150 minutes a week. This is evidence-based and it just shows that itself is enough. So less than 30 minutes a day if you exercise, that will help you in prevention and in many of prevention of the disease and helps in reversing the diseases. And this is the one which I said, very important, muscle strengthening activity, at least 2 days a week. And yeah, this is a myth we just wanted to say, like, oh, I'll eat any kind of stuff because I'm going to the gym. The math will never add up. This is entirely different. Exercise is different and your food is different. So see, these calories are 1,000. And if you run for 30 minutes at 8 kilometers an hour, you're only, 240 calories you're spending. So this is the one you'll always see, 6 pillars of lifestyle medicine. So it's not just the food. I know we always have these groups called plant-based and a lot of people, are even afraid to join. So it's not just the foods, what we are talking, all these extra stuff, which you have to do, even if you're, 90%, 80% in healthy eating. And if you do all this well, you'll get the same benefits. So please encourage your family, everyone to, learn about this lifestyle medicine. So, Dr. Mithika has, really gave us a lot of information about risky substances, which everyone, don't even talk about it. And so this sleep you need to have like 7 to 9 hours of sleep minimum. So even one day, if you have less sleep, next day, people with diabetes will have high blood sugar. So you can, you can actually check. So make sure you cannot make up the sleep like, oh, today I'll sleep 5, in the weekend I'll catch up. It doesn't work like that. So sleep is very important. And the other most important is healthy relationships. This we know now because of the COVID, how important it is. Most of us realize, and we are social human beings. So healthy relationships is very, very important. And actually, there was a Harvard study. It's still going on. It's a 75-year cohort study with some from Harvard students and the inner city Boston men. And they said the single most predictor for happiness and longevity was social connections. So that I'm like so happy about the temple. See, because of the temple, you are all getting to hear with such wonderful speakers today. We would actually pay for a conference thousands of dollars to listen to such a talk. So, we brought it to your house. The temple actually brought it to your house. So the social connection, I remember when coming to the temple, when Dhanamurti ji gives us the prasadam, we all stand in a line. He actually talks to each and every person. And sometimes I know we are like, let him finish fast. We are we have to go home, or we are waiting for the food. But that single, like, I think it's called micro moments of connection. It actually has proven it, changes your body chemistry, stress relieving, and it improves your health. So whenever you're in a grocery store or you're walking, just say hello. I mean, genuine hello, not just liking something on the Facebook. Just pick up a phone, talk to someone. It'll help them and help you. So that is what I wanted to just quickly tell. It also helps in sleep and so many other stuff. Main other thing is for dementia. See, the other important thing, we are always worried about our weight and, blood pressure and all that, dementia and Alzheimer's disease. There is no cure, it's only prevention. So sleep, social support, exercise, all these lifestyle changes will really improve that. And so we are doing this 8-week classes. Since the temple is, doing so much for our community, we came together. We wanted to give something back. So this will be on by donation. I mean, we'll assure you everyone will benefit from these classes. We have whoever cannot come, even a family member who's caring can come and they can help them. So it's not just for diabetes, hypertension, any lot of GI issues, but also it's just, for you to be healthy, to prevent chronic disease, including dementia and all that. And there's nothing which we said today, which is something different. It's been said by, father of medicine, Hippocrates. He said, let food be thy medicine and medicine be thy food. So that's what we are telling. And even Sushruta has said in 600 BC that, he was the first to prescribe exercise for his patients, for the diabetes patients. Charaka actually prescribed strenuous exercise to cure diabetes. So, this is our site, plant-based losangeles.org, where we have all these recipes there, and then you can follow us on this Facebook. And if you need to see follow all the lifestyle medicine physicians, this is another Facebook site where we post all these educational videos. And see, these are all the foods prepared by all of our WhatsApp groups, by LA Telugu Association. There's a San Diego group. So please join any of the groups, and thank you so much. I would like to thank Dhanamurthy ji again for giving us this wonderful opportunity. Sirisha, you want?
Yeah, thank you. Thank you, Gnanamurthy ji. And we feel blessed that we are able to do this for Krishna Temple. It's not now, but from the time when my kids are very small, we're associated with this temple. We used to go every Saturday, and kids used to learn slokas. That's how I met Dr. Anita, as I said before. So temple is something we all value in the community, especially during COVID times. We need to support our temples and take this as an opportunity not only to better your health, but also to support the temple by joining this 8-week weight loss and diabetes workshop or session we are doing. I and Dr. Anita and the experts will come in between in the classes to educate more. So please share widely with your friends and family, and don't miss this opportunity to better your health in 2021. And then once for all, get a healthy, plant-based lifestyle into your lifestyle. Yeah, thank you once again.